I'm Captain Thrasher.
And this is First Lieutenant Correa.
And I am Sergeant Choi, and we're with the 18th MP Brigade Behavioral Health Team. And in this video, we're going to be talking about sleep hygiene. Sleep is something that we all need that many of us don't get enough of. We may have difficulty falling asleep, staying asleep, or both. Some of us suffer from sleep problems for only a short moment. However, when sleep problems become more of a norm, we may experience more than just feeling tired. You may experience direct impact in your work performance or experience drastic changes in your sleep or physical health. We understand that being a soldier means there will be many days where you won't get enough sleep. That's why in this video, we want to tell you about different ways to improve your sleep.
What is insomnia? Insomnia is a sleep disorder in which the individual has trouble falling asleep or staying asleep. It could be short-term or long-term. It can also come and go. So when is insomnia chronic? Insomnia is chronic when it happens 3 times per week for more than 3 months. So why do we need to sleep? We need to sleep in order to recover from the wear and tear of our bodies through the day. Actually, tissue repair, muscle growth, and protein synthesis mainly exclusively happen when we are sleeping. Now, what happens when we can't go to sleep? Our mind and our body cannot fully recover. And what happens when our mind and our body cannot fully recover? We're gonna start using coffee or energy drinks or other substances in order to fight sleep. Now, that's actually terrible, but because when it's time for you to go to sleep, you're not gonna be able to go to sleep. What's gonna happen is that you're gonna enter in a cycle in which you're gonna break your body and your mind further and further.
Did you know your body has a built-in clock known as a circadian rhythm? This clock is directly influenced by environmental cues, especially light, which is why we naturally fall asleep at night. Melatonin is a naturally occurring hormone that is influenced by light, especially blue light. Melatonin tells our body it is nighttime and thus it's time to sleep. When the sun comes up, the light reduces the melatonin, keeping us awake. And when the sun goes down in the evening, melatonin increases, making us sleepy. As we age, the body produces less melatonin, and therefore we need less sleep. That's why younger people often need more sleep than older people. What happens if you stay awake? The homeostatic sleep drive, also known as sleep pressure, builds in our body as our time awake increases. The pressure gets stronger the longer we stay awake and can only be decreased by sleeping. Once we're awake, the pressure builds again and the cycle continues again into the next day.
When you sleep, you cycle between REM and non-REM. REM stands for rapid eye movement. During this time, your eyes move quickly in different directions. This doesn't happen during non-REM. First stage. Your eyes are closed, but it's easy to wake you up. This phase may last for 5 to 10 minutes. Second stage. You are in light sleep. Your heart rate slows and your body temperature drops. In this stage, your body is getting ready for deep sleep. This stage lasts about 20 minutes. Third stage. This is the deep sleep stage. It's harder to rouse you, and if someone woke you up, you would feel disoriented for a few minutes. Also, during this stage, your body repairs and regrows tissues, builds bones and muscles, and strengthens your immune system. Fourth stage. This is the REM stage. REM sleep happens 90 minutes after you fall asleep. This first period of REM typically lasts 10 minutes, and then each of your later REM stages get longer. The final one may last up to an hour. Now that we understand sleep better, I want you to take this time to ask yourself these questions. Number 1, on average, how many hours of sleep do you get per night? Number 2, Do you have trouble falling asleep, staying asleep, or both? Number 3, how often do you have trouble falling asleep or staying asleep? Number 4, for how long have you been struggling with insomnia? Number 5, what things have you tried to help you better sleep? And did they work? These are some of the questions a sleep specialist may ask in order to understand your unique situation and to come up with the best possible solution. While there are many options for treating insomnia, the easiest way to improve your sleep is by practicing good sleep hygiene.
What is a sleep hygiene? Many people heard about the term, but they don't know exactly what it is. It doesn't have to do anything with cleanliness. There are the habits and the practices that we use on a daily basis to be able to sleep well. A sleep hygiene is more than a bedtime routine. There are the practices that we use to sleep well and to feel alert during the next day. Here's some of them.
Number 1, sleep in a cool, dark place. We know that the environment impacts our sleep, so we want the temperature to be nice and low and very little light in the room. That includes not using any devices or TVs, as well as maybe getting blackout curtains or shades to keep the light out of the room. Number 2, go to bed only when you're sleepy. This may mean you have to delay your bedtime a little bit, and that's fine. Just make sure to engage in relaxing activities during that time. You don't want to get too activated while it's still close to bedtime. And remember that if you do shift your bedtime, you still have to wake up at the same time the next day in order to maintain your sleep schedule. Number 3, avoid clock watching. So when we're in bed and unable to sleep, once we look at the time, we start doing the math and we start thinking about how much sleep we're going to get and worry about how little sleep we might get. So instead of looking at the clock, simply roll over and try and go back to sleep.
Number 4, you snooze, you lose. If you hit snooze button, then you are only allowing yourself to get light sleep. Do not rob yourself of the best sleep of the night, which is right before the alarm goes off. You can set the alarm as late as you can, and when the alarm goes off, you obey it and get off the bed. Number 5, your bed is meant for sleep and sex. This means you want to associate your bed with only sleep and intimacy. Just as you associate kitchen with hunger, you'll want to train your brain to think that bed equals sleep. When you're playing games, or working, or eating all in your bed, then essentially you're training your brain to stay awake in bed. Number 6, try not to take naps. Some people do well even if they take naps. If you've already been struggling with insomnia, chances are naps are more harmful than good for you. You'll want to be as tired as you can when you're actually going to bed at night. When you take naps during the day, you are releasing the sleep pressure you've been building all day. You'll want to balance it just enough so that when you actually go to sleep, your sleep pressure is at a peak level, making it easier for you to fall asleep. If you have no choice but to take naps, we recommend no longer than 30 minutes because 30 minutes is how long it takes until you enter the deep sleep.
Number 7, avoid using alcohol, nicotine, or caffeine. All these substances interfere with your ability to stay and fall asleep. For example, caffeine can keep you awake for hours. Alcohol, on the other hand, can worsen sleep apnea. It also forces you to wake up during the middle of the night to urinate and reduces REM sleep. Most sadly, you will build tolerance. So you want to consume more and more alcohol in order to achieve the sedation. Number 8, make sure that you have a lighter meal before you go to sleep. Also make sure that you keep a balanced fluid intake. Now, if you wake up during the middle of the night, please do not have a snack because there is a probability that your brain will associate awakening with hunger. Number 9, this is the time for you to decompress. Give yourself at least an hour before bedtime to prepare and relax. You can use deep breathing exercises, guided meditation, and most important, set up your room to prepare for sleep. Avoid stimulating activities such as exercises or cold showers. Number 10, be consistent. Be consistent with your sleep habits. You won't get any improvements in sleep just because you practice sleep hygiene for a couple of days. The key to getting a restful sleep lies in your ability to be consistent with your sleep hygiene.
You don't have to remember all of these sleep hygiene tips. Start by using 1 to 2 and slowly add more like you would tools to your toolkit.
If you struggle, please don't hesitate to look for professional help. Thank you for tuning in. Hopefully you learned something new today and stay ever vigilant. Bye.
I was counting.
Oh, sorry.